of women abuse Clomid, and because they don't get the results they want, they keep abusing it, they keep misusing it. So in this video, I'm going to tell you when to take Clomid, what Clomid is all about, and the right time to take Clomid. If you're seeing this face for the first time, I'm Chidima Michelle Oswago, a certified nurse midwife and a nutritionist. And in this channel, we get to talk about everything about mother, child, and family at large. So if you're interested in this topic, keep watching. I call Clomid the ovulator stimulant. How does Clomid actually work? What does it do, and how does it help treat infertility? Clomid actually helps in increasing these two reproductive hormones, the FSH and the LH. That's the follicle stimulating hormone and the luteinizing hormone. These two hormones are responsible for stimulating ovulation, causing maturation and release of these eggs into the fallopian tubes for fertilization. Now, let me bring it down for my viewers who are not in this medical field. For easier understanding, ovulation occurs when a woman releases eggs from her ovaries. Then it goes to the fallopian tube. When the man has sexual intercourse with the woman, the sperm swims up down to the fallopian tube and fertilizes this egg that has been released. So what makes this egg to mature and be released are these two hormones I mentioned, which are the follicle stimulating hormone and the luteinizing hormone. So these hormones causes the eggs to grow, mature, and be released into the fallopian tube. So if these two hormones are low, these eggs will not be able to grow, be matured, as well be able to be released into the fallopian tubes for fertilization. That means ovulation will not be able to occur. So what does Clomid actually do in this situation? It increases these two hormones I mentioned, helping the eggs to grow, mature, as well be released into the fallopian tube. That's just what Clomid does. Now, it comes in 50 milligrams, and you can take 2 tablets, that's 100 milligrams every day for 5 days, depending on what your physician wants to achieve. Now, I would not advise you to go into a pharmacy and get Clomid and start taking, because Clomid comes with side effects which need to be monitored with the doctor. How to take Clomid? Some people will tell you to take Clomid from your cycle day 5, forgetting that every woman is unique, having her own menstrual cycle length. Now, starting from day 5 will work best for people with 28-day menstrual cycle. So what works for Mr. A cannot work for Mr. B, because every woman has a unique menstrual cycle length. So you have to know your menstrual cycle length before you start taking this drug. As well, your ovulation day and your fertile days. It's advisable to start it 3 to 5 days before your fertile window starts, because a woman with 28-day cycle is likely to ovulate on the 14th day. The drug is to be taken 5 days before your fertile window starts. For instance, a woman with 21-day cycle, when she hears that you're supposed to start this 5 days before your fertile window, she will be like, okay, not knowing that she is likely to ovulate on her cycle day 7. So you see that if she takes this Clomid like every other woman in her menstrual cycle within this range, she will be taking the Clomid, even taking it during her ovulation. At the end of the day, it is not going to work out, and she keeps misusing it. That's the essence of what knowing your menstrual cycle length. It's very, very important for every woman. So a woman with a shorter menstrual cycle length, she can start taking this drug from the day 2nd of her menstrual cycle. So you see why it's very important for you to know it, so that you don't misuse this drug. Right time to have intercourse when using Clomid. Once you've taken this Clomid, like I've earlier said, all you need to do is have regular sexual exposure. You can do it today, alternate days. Just explore and relax. Once you've calculated the ovulation day and you know when likely to ovulate, you can watch my other video where I explained how you can know when you're ovulating. Make good use of your ovulation period, and hopefully things will work out. Clomid is not for everybody. Now, before you start taking Clomid, you need to do a hormone test. Now, if you do a hormone test and from the result they discover that the FSH and LH is low, Clomid will be the best option for you. Once you take it, it will increase these hormones, and your chances of getting pregnant will be there. But if you did a test and the cause of your infertility is not associated with low level of these hormones, it is not advisable to just rush and start using Clomid. For instance, you have a blocked fallopian tube. Having a blocked fallopian tube does not mean you're not ovulating. You can be ovulating, you release the egg, but the pathway which the sperm is going to come meet the egg is blocked. So you just keep hyperstimulating your eggs to be producing more eggs, and at the end of the day, there is no road for them to pass and do their work. So you see that Clomid is not for someone with a blocked fallopian tube. Also, women with fibroid, depending on the position, and endometriosis. So the people who need Clomid are people with ovulation problem. You're not ovulating. Your hormones, the hormones responsible for these ovulations are low. So you now take Clomid. Clomid helps increase these hormones, and you ovulate and you get pregnant. Now that brings us to the side effects of Clomid. When you're taking Clomid, there are tendencies that you could have headache, nausea, vomiting, fullness of the abdomen, dizziness, as well as what? Mood swing. But the good thing is that once you're done with these drugs, these symptoms go away. So the major side effects are like breathing issues. Some women can take Clomid and they'll just have difficulty breathing. But if you experience such a side effect, you need to go to the hospital. Also, multiple pregnancy. And this is the one women like so much. They like it when they just take a drug and they can be pregnant for twins, triplets. Now, because Clomid causes hyperstimulation of these eggs, it can what? Make these eggs to be released more than one, like 3, 4 eggs. At the end of the day, you can be carrying twins, you can be carrying triplets, you can even be carrying quadruplets. Even some women can even go as far as getting 6 babies at once. The major side effects of the drugs. Bear it in mind that Clomid is not the only drugs that can help with ovulation. So if you have these major side effects like difficulty breathing, there are other alternatives the doctor may decide for you. So there are other fertility drugs that can work aside Clomid. Like the doctor can look at your history and even prescribe letrozole for you. Able to know the cause of this infertility before you start taking Clomid. Now, take for instance, most male factors can be the cause of the infertility. Maybe the man has low sperm count, ovulating, you don't have a blocked fallopian tubes, and every day you keep popping yourself with what Clomid, not knowing that your spouse has a low factor issue that needs to be what corrected. You need to know what the cause of the infertility is before what popping up Clomid. Success storylines of people who have taken Clomid and it worked for them because they had an issue with their ovulation. Before you take Clomid, endeavor to what? To run a test, be sure that the cause of your infertility is associated with your ovulation and your spouse is okay. And at the end of the day, everybody's gonna be fine. This video was helpful. Endeavor to subscribe to my channel, like my video, share to those people who may need it. Thank you for watching.